Yes. I'm Souvik Bharat, Principal Scientist and Head of Enterprise Digital Twin Research Initiative at TCS Research India. Today, I'll present our approach that helps to explore various strategies towards a safe return to a new normal in the face of uncertainty that are created due to COVID-19 pandemic. I'm not a medical expert, or my profession is not from the medical side, but what I'll argue that this from the system theory perspective. And also, I'll illustrate a case where you have a kind of domain information, in this case, epidemiological information and the socio-economical factors. How can we model them and make it available for the right set of stakeholders for more of a evidence-driven decision making? That's the case I'll present. So as we all know that COVID-19 actually challenged us in many ways in last 2 years, and it has actually make a trade-off between individual health safety on one hand and socio-economic progress on the other. And at least from last 1 year, we are trying to return to a new normal. But whenever we plan such kind of things, such new variants are coming and disrupting our visions. So now, one thing is very clear that we need to live with this infection at least for some time, and still we need to return back to some kind of new normal. The question is, what would that new normal be? When or how can we return to that new normal? So such kind of questions everyone is trying to answer, and what we are trying to do is, are we trying to introduce some kind of scientific way to explore various situations, and also possibly introduce a technology for such kind of exploration, and so that decision maker can explore things in silico without impacting the real context, and then understand or gather sufficient knowledge or experience to make certain decisions. So that's the kind of context. However, we all know the situations are not very suitable for such kind of situation. In one side, we there are a lot of things are changing. Even country, state, and city, they are changing the infection situations. Local administrators are taking several decisions. Even people's perception are quite different, and it's changing with the time. There are a lot of uncertainty in the space of whether new mutant will be there, what would be their characteristics, whether vaccine will be effective on those kind of variants or not. Losing immunity is another concerns. And when we are thinking about decision making for a large city or state or country or even a large organization, things are very complex because there are a lot of heterogeneity. Uh, in terms of socio-economical factors, and also size matters. If you see, there are a lot of ambiguity because there is no consensus about what should we do for a particular situation. We are almost 2 years, but still we are not clear about such kind of thing. Every time, or probably in a continuous basis, we need to analyze the situation, not only from the kind of new mutant or such kind of context, but also economy, health, safety, mental health, equity, and all those kind of things to take a decisions. Now let's go back to the kind of how other people are kind of solving or trying to help decision makers. So if we analyze a literature review, we will find that there are significant number of models and analysis techniques are presented in last 2 years. They can be broadly categorized into three. One is data-centric statistical model. So what they do is they try to analyze the historical trend and try to predict what will happen at least in next 2 to 3 weeks. But consider a situation. There are certain cities where the testing is very low, but whatever you see, in that case, whatever you are seeing is may not be accurate of the reality. Then even if you use very sophisticated AI or analytics, your interpretation might be wrong. Then there are compartmental model like ACIR model, and also there they try to capture domain knowledge in terms of epidemiology and analyze the situations. The only thing is there are a lot of they are not cognizant the heterogeneity or individualistic behavior that we see. It's very critical to analyze. On the other hand, we have agent or actor model. where you can capture individualistic behavior, you can understand the emergent behaviors and macro level emergent behavior, but it's very difficult to scale. So what we do as part of our approach, first of all, we try to create a virtual environment which is as close as real. And we combine data plus domain model. When we say domain model, it's epidemiological aspect, demographic aspect, and socio-economical factors. And for that also, we use three types of model. One is agent-based model, coarse-grained model, and definitely we use probability model to capture random phenomena which we see in the reality. Second thing is AI we use, but not at macro level, but more of a micro level to understand the propensity, affinity of those actors we are talking about. Then we focus on control theory for coming up with the interventions and adaptations. And everything is actually mixed with a kind of combined and enabled through a simulation-based experimentation aid, which help us to kind of experiment, think in silico and provide some kind of consequence. If you do that, what will happen? For example, I can now create an agent with a new that replicate a new mutant with a different kind of characteristics and put into the simulation environment, and we see if such kind of variant exists today, what would be the situation maybe 2 months or 3 months later. So that gives us a kind of very much clarity about what can be done. Now, I'll just briefly explain two case studies that we have done. One is for the city context, another for the organization context. So city context, when we say decision makers, people, city administrator is mainly interested to understand what kind of interventions in terms of lockdown relaxation I should apply, when I should apply, if I do that, what would be the consequence, and so on. On the other side, healthcare organizations, they would be interested if there is any new relaxation or new mutant, then what would be the additional burden that one can think about? How can we mitigate that? How can we utilize the resource? If I can do it in advance, probably it will be much more effective way to control the situation. And that's how we constructed a digital twin for a city, where we considered epidemiological aspect, various things like transmissibility and all, city-specific demographic information at the various places in terms of the school, office, marketplace, and all those concerns we model. And we also introduce the interventions that already applied, or the hypothetical intervention that we would like to apply. And then you simulate and see what would be the possible outcome of such kind of thing. And you do it in silico without impacting the real city. Once you are confident about certain kind of intervention, you take it into the city level. So that gives us more clarity what can happen in the future and why I'm taking such kind of decisions. So this kind of things we applied in a city where I'm located, Indian city where I'm located. And last 1 year, we are working with the city administrator to explore various scenarios, like if I opens all the shops versus office, what would be the situation? What would be the efficacy of weekend lockdown, and so on. And many things are also appeared in the news article, local newspapers. From stochastic side, we also published a paper which talks about our model, and that we published in January 2021, and predicting when the second wave can come. So, and if you see here, so from the particular figure, we almost estimated the second wave, which the timeline is very precisely matching with the reality. So that's one case, and then the other case is applying such kind of things in a large organization like TCS India. Even if we have around 400,000 employee in TCS India. Currently, they are operating at 2,000 different cities, and each city are kind of experiencing different types of kind of infections spread. And how can we take a decision and understand, even if we continue work from home, what would be the situation? Or can I, if I allow 25% people coming back to office, then what would be the situations? So for such kind of things, and defining or refining business continuity plan, we constructed a digital twin. Again, the kind of relevant concerns of interest here, epidemiological aspect, then age, gender, comorbidity, and all kind of demographic distribution of the employee, the dependent, and staffs. Then employees are distributed in different cities. What are the macro level trend of the city? Because people are interacting with the rest of the cities and getting infected, which actually causing them to absentees and so on. So what would that be? And definitely office canteens and office layout, so that people when come back to the office, what are the possibility of getting infections, or what if I open canteen, what would be the situations, or when can I open other facilities? So all kind of explorations you can do with much more precisions and so on. And so far, whatever the experimentation result that we got is very much matching. Our predictions are matching with the reality, and that gives us a kind of confidence that it is working in real situations. And also, we are very hopeful that such kind of things are very much useful for the context of other problem, which is probably beyond COVID-19 pandemic. For example, sustainability initiative or smart city initiative or pandemic and disease control in general, because it has the similar kind of context, and it has all the characteristics that we already addressed. So with that, I'll stop at this moment, and I'll happy to answer any questions that you might be having.
Thank you very much for this interesting talk.
Those who would like to understand about our research, TCS research, there are certain pointers. So if you have any questions about that, I'll be happy to answer.
Yeah, there's one question. How do you ensure a digital twin of a city? How do you ensure that it's faithful to the reality?
So yeah, that's a good question, because all our prediction depends on whether how that digital twin or the virtual environment is close to the reality. There we actually adopted a method called operational validity. So you use kind of a certain known scenario and try to 4, 5, or even 10 scenarios, and try to create a similar environment and simulate and produce result, and see they are matching with the reality on the expectations or not. That's one kind of validity we do. Then other types of validity is more of a known as conceptual validity. So we experiment many things, and then we go to the domain expert and say this is what it is happening, and this is why it is happening, and that gives us kind of one type of validity. Whatever the model is saying is correct, and probably all the behavior that are relevant are captured appropriately. So these two types of validity gives us kind of a bit of confidence about the faithfulness.